good day and good deeds. Welcome to the We Do Good podcast. We believe one good deed can change everything. I am your host, Charles Dame, and today we are talking about something that touches every family: health, heart disease, prevention, and the future of medicine. Our guest today is Dr. Anmol Kapoor, a cardiologist, entrepreneur, and healthcare innovator based out of Calgary. He has worked in Calgary and internal medicine, and through his ventures and nonprofit work, which has been absolutely phenomenal, he has focused on preventative health, community wellness, genomics, AI, and helping people live healthier lives before a crisis happens. Dr. Kapoor, welcome to the We Do Good podcast.
Thank you so much for having me. It's such an amazing topic, and I believe in doing good. So if you think good, you do good. So always start thinking how you can help other people, people who are less fortunate, and if you can, even you don't have to spend money. If you can just give them the kind words or listen to them, that's the best thing anyone can do. So do good. I love that.
It's amazing. Me too. Before we get into the technology and kind of like the big vision, which you are definitely a big vision guy, I want to get a chance to start about you, the person, you behind the medicine and who you are. You look back over your life and the things that kind of brought you to where you are. I know that I do that in my life. When you look back, what pulled you towards medicine?
Well, I grew up in a family of refugees, you can call it. So my dad was born in a refugee camp in 1947 when the new India and Pakistan new countries were born. My original homeland, the Punjab, was divided. So my grandparents had to migrate to the India side, and my dad was born there. And I saw the impact from various environmental factors growing up in that family. And my dad studied and started joining a pharmacy background, and he became a pharmacist, opened up his first pharmacy in India, in Punjab. And I get to know the challenges people are facing, especially marginalized communities, the poor people. Rich can access healthcare. It wasn't a good healthcare to start with it, but at least they can access something. But the poor class could not even access much. So I've seen my dad waking up in the middle of the night because his blood is a universal donor, his blood group. So, and in rural Punjab, we didn't have any blood banks at that time. So when I was growing up, people will knock on the door and they will wake him up. They will get a recommendation from the emergency room. They're looking for blood donors. And at that time, they're looking for someone who, because someone got injured, there's no one else to help out. And he would just wake up and he go and donate his blood. He probably have donated hundreds of thousands of times, probably. I still remember so many times, knock on the door, middle of the night, he'll go there, donate his blood, come back, sleep, get back to the work in the morning as a pharmacist. So I saw him doing service, and I got exposed to medicine myself through that. That inspired me to join medicine and help find ways how I can make healthcare more decentralized, more accessible for people, more affordable for everyone. I believe a good quality healthcare is a human right. It just should not be confined to the richest, most powerful people. I think every human being on this earth should have a right to access the same healthcare which the richest most person can access.
Yeah, I know, you have trained and work across all kinds of cultures and places in this world. How has that, being able to understand, one, you speak a lot of languages, which is really, really cool. I only speak one, and then I just try to understand a little bit of what everybody else is saying. Fortunately, I speak laughter, so that usually works out pretty well with most
It's
people.
the best language, laughter and music.
So, how did, being across cultures and seeing the different things, how does that help you shape the way you see patients?
Well, I grew up in Punjab in a low middle class family as per Punjabi standards. But from there, I went up to Russia to study, lived in Siberia about 5.5 years, then to St. Petersburg to finish my clinical training further, and graduated as a medical doctor from there. I had to learn a Russian language before I could join medical school. It was a criteria. I had to learn the Russian language. So I mastered it and continued to learn Russian and earned the certificate as a teacher of a Russian language. Same time as I earned my certification in medical school there. From there, I came to Canada. What I learned in Russia at that time, they were really good in public healthcare system. I still remember old ladies or guys, so they would carry their health record, paper record with them. Right now, we're in an era of technology, health record system, AI, and all of those things. Now you go back 20 years. So at that time, a health record used to be in doctor offices. And in Russia, I saw that the health record was carried by the patient. So they will go doctor to doctor, and doctor will write their note, their observation, their imaging, X-ray report, blood test report, or the prescription there. And now they go doctor to doctor. They carry the whole book of life with them. So that inspired me to see how I can apply that knowledge into technology. Did my further training in Canada, in the University of Lethbridge, to learn how to do the programming, C++, Java basics, etc. So I can understand how the coders code, what the languages speak. So I learned some of those languages, but born and brought up in Punjab, no Punjabi, Hindi. Obviously, we pick up English along the way and Urdu. So that allowed me to use different parts of mind and understand um, people. All of us, we come from different backgrounds. We have each of us has a unique story to tell, unique experiences. So those experiences, stories, and the context of that is very important. And everyone, if I can say, able to speak the language, it can put together where they come from, what background they come from. They could be firefighters, first responders, could be a taxi driver, could be an executive in tech company. But we all are humans, but we come up with unique stories. So knowing these languages, meeting with people all over the world, open my mind to unique ideas, and that's what made me who I am today. And growing up in Punjab, living in Russia, in Siberia, then moving to Canada, and then here writing exams for internal medicine training, cardiology. When I came here as an international doctor, it was very difficult to get into medical training here as a public healthcare system, and to be able to fight for system, being a visible minority, and be able to relearn my brain because I was trained in Russian language, so I had to relearn my brain in English. And when I came to Canada, I was speaking more Russian than English. So then I have to train my brain. The way you can think of like the Massey's training or someone else's training, I trained my brain at that time. So and then I passed my exam, get through it with excellent recommendations, letters of recommendation from my colleagues and supervisors, and kept accelerating this journey of knowledge gaining. And when I graduated as a cardiologist, I didn't stop there. I wanted to master further in vascular medicine. So spent some time in Cleveland Clinic, then came back to Canada, and then started my first venture, first startup. As I saw lots of gap that exists within the public healthcare system, and I saw that America was doing amazing in vascular medicine at that time. So I wanted to learn some of those things and come back to the country, who gave me an opportunity to become a doctor and be practice as a cardiologist, and help improve quality of care here.
Yeah, that's I heard one thing was repetitive in a best of ways right there, and that is your capability to learn. You took the ability to learn from the cultures you've been to, seen what they've done, seen what they have done in medicine, what they've done in their areas with it, and developed on it and made it better and grown. And that's such an amazing trait to have. It's pretty cool that you've been able to do and accomplish the things. We're getting into all of it today, what you've accomplished, but it's amazing to see all you've accomplished. And a lot of that comes from somebody's ability to learn and move forward is phenomenal. What would you say for our listeners who don't know you yet would best describe your mission right now that you're on, maybe in a sentence or two?
Well, my mission is to empower people and make master of their own destiny, especially from a health perspective. A lot of people don't know they can get a better health care. We do have a lot of gatekeepers along the way. I do believe healthcare should be decentralized, should be accessible by anyone. And I do believe that people should own their own data, should own their own destiny to decide what's best for them, for their families, for their kids, and that knowledge is available for them at the cheapest way possible.
Yeah, this is a little off the subject. Have you ever heard of Gary Brecka?
I heard of.
Yeah, he's got some different stuff going on. What do you think about the things he talks about as far as the chemistry side?
Well, it is a unique concept. It's a good concept, and I do believe that has a validity in today's day and age. And I do agree. Obviously, every smart people we disagree on a few things, but in the core of that, I think I do believe. I think the core principles are pretty good.
Yeah, yeah. When you said own your own destiny or be up to speed on your own stuff, that kind of reminded me of like what I seem to see that guy preaching a lot. You don't just see patients in the exam room, right? You've built an organizations, clinics, foundations, a tech company in healthcare, right? Where does and I when we met at Mar-a-Lago, you were just the drive was awesome. Where does it come from? Where does that drive come from in you?
I guess drive comes from my maybe my faith because I'm a Sikh. So Sikh means a student, and that pushes me to become a student for life, and always challenge myself. I don't believe that anyone else is challenging me. I just like to challenge myself. Like there's a new way of solving this problem, and I need to know. I need to master that. And if not many people know, I should seek that knowledge, be the student of that knowledge, listen to that person who's speaking, and see if I can take some knowledge and apply to the projects I'm doing and keep improving. So when I mastered cardiology, I got bored in cardiology. So I said, well, I have learned everything I could have learned. There's not much else left. I got bored after cardiology. People will sound very sometimes interesting to many. Like cardiology is the peak of medicine, and many of my colleagues they love what they're doing. But to me, I have mastered it. So I need to. I found the gaps in the healthcare system. So how do I do more? And where the patients are coming to me, they're telling me, Dr. Kapoor, tell me why I have this problem. I have heart failure, and why do I have a heart failure? Or I have this medicine I was given. I got the side effect. Why did I get a side effect? And the only answer I used to give them, but in medicine we used to give them called idiopathic. When we don't know, we want to sound scientific, we say idiopathic. What essentially the joke is, a doctor's an idiot and patients are pathetic. So no one knows an answer, what is the problem? If you don't understand it, we sound autoimmune. So to me, the desire was that these descriptions we have, they're too loose descriptions. We have to have an answer. There has to have a reason in biology that why people are reacting this way. We just don't know the answer, and we are pretty much denying people an access to the knowledge. So that's where my journey started in precision medicine, into AI, into genomics, multiomics, trying to find an answer. So that's where drive comes from. So I'm a lifetime learner. So I'm learning from you. I learn from people and use the knowledge from everyone. I use knowledge from a person on the street walking, or could be a very senior executive. So it doesn't matter to me. I'm looking for knowledge from all of you guys.
Yeah, it's amazing to hear that drive right now, right while you're talking. It's just there. You have a background in medicine, and you touched upon the places you've been in St. Petersburg in Russia and the University of Manitoba, if I'm saying
Manitoba.
that
Yeah,
right.
this is the
Okay,
center of Canada. Yeah.
and okay, and the University of Alberta. And I know you've done so much. One of the funny things is on my end is I had a heart attack about 4 years ago. I had a 96% blockage in my left main ventricle, and I just ignored every sign that was probably screaming at me. What would be like for you, for the people that are out there, the layman's like me, or the Marine, which I am, right? I'm not going to the doctor. What would be some of the key warning signs as far as with the heart that we shouldn't be ignoring?
Well, there are many signs, and the best sign is look in the mirror, look at your face. So if you are looking older than your age before, uh, then your body is aging faster. That's the first sign. We don't pay attention to that. We are losing hair. It's another sign body is telling us that hey, you are getting old. Your hair turning white. You are getting old. Yes, right now you may not feeling any pain. You're not feeling any aches there, but doesn't mean your body is not getting old inside. So we look good, we are having a fun and party biology, but keeps the dates. Biology doesn't forget it. That we are developing these blockages. It's inflammation that is happening. That is aging us faster, developing wrinkles on the face, wrinkles around the neck. All these signs are of aging. Some people age faster, some people age slower, but people do age. And having a blockages in the heart arteries is an aging process. And some people don't even develop it till age of 80. Some people develop in age of 20 sometimes. It just
Yeah.
accelerate aging process. That made me, that's why I go into longevity space. So I tell people in a joking manner, I was speaking in Dubai conference on a longevity. So I said, I'm a cardiologist. So before people meet their gods, I come in between. So I can delay the meeting to their gods. So I can keep them on earth a little bit longer. Why? Because it's a heart disease that kills people more than anything else on earth. Then the cancer comes in, then the traumas and many others, the chronic diseases, diabetes, etc., comes in play. So, but eventually, it's the heart disease that kills it. So we can understand much earlier, and heart disease does not have any symptoms at that time. It is start at the age of 2, age of 5, age of 10. We have no
Yeah.
symptoms at that time. We
That's
are
what I was kind of
competing in
wondering. It's
sport.
like, when do you, what have you, like, what would be your wish as a cardiologist if you could see one of your patients 10 years before you actually see them? Because I'd manage most of the patients that you see when they're there. It's, they've already got heart disease. So what is it that people can do to help not see you?
Well, and that's an article I wrote today. There's a blog I wrote on LinkedIn. If you follow me on LinkedIn, please do read them. They're publicly available for everyone. It's
Yeah, we'll
actually
check it out
talking.
on LinkedIn, everybody.
Yeah, so it is actually a topic I didn't know this question you're going to ask me. Today morning, there is a patient I had, and there's a lot of propaganda happening on statins and many medications, especially the middle age group is exposed to misinformation a lot. Yes, there is because of medicine not being clear to people to understand, and also doctors are also missing it too. And today's day and age, the power we have, the knowledge we have, how to manage the lipids, how to manage inflammation, how to stratify people using very genetic investigations, LP little a, PCSK9 inhibitor medication are available these days, and more things are coming in the market. The tools we have, what I'm observing is that A, the people don't want to use the tools or they're not aware of how to use the tools properly. B, the doctors are not even using the tools properly in the right manner. So what everyone is doing is take a diet. If you find a high cholesterol, use some diet and come back. I don't know which diet has helped reduce the chance of developing heart disease. Maybe a Mediterranean diet has shown to have some longevity benefit and less heart attacks happening. But Greeks also get heart attacks. They also have blockages. You can't just say Mediterranean diet is 100% foolproof olive oil diet that you take it every day and you're going to never have blockages. There's no diet that can say you'll never have blockages. But what we know today from science, if someone has a LP little a levels high, which is a genetic biomarker, if you have it high, doesn't matter how much statin you're going to take it, it's not going to help you. Then you have to graduate yourself to the next level, which is PCSK9 inhibitor medications, and soon there'll be LP little a lowering medication coming out. So lower the exposure you keep, the longer you're going to live. The analogy I give to my patients is usually if you take a wood and you're going to take a wood and put it soak it in the water, nothing will happen to it. But if you keep a wood in the water for a long time or keep moving in water for a long time, it starts to get damaged. Why? Because exposure in water is the longest. So if you have an exposure to high inflammation in your body, exposure to high cholesterol particles in the body, moving around for a lifetime, the exposure matters. if you can reduce exposure in your blood, there's a less chance of developing blockages. That's the message I want to give to people. When you see me, when you have a blockage, it is too late for me.
Right.
The train has left the station. So most healthcare system is designed at that stage. It's too late. We have to start picking people at a much earlier stage where there's no disease. And at that time, lower the exposure. Eliminate as much as you can ApoB levels, lower LP little a levels, reduce inflammation in your body, because a heart attack is an inflammation disorder, is an inflammation disease. Why is it happening? Because body is aging with inflammation. And inflammation triggers a heart attack, builds up blockages, and cholesterol, calciums, and all of those things, they get accumulated, they work together in that. So reduce inflammation much early on, reduce exposure much early on, eliminate anything that causes inflammation, smoking, obesity, diabetes. So eliminate these factors as much as you can. And if you're able to do that, there's a less chance of having blockages and you'll be able to live longer. So that's the message I want to give to people is that's what I'm talking about. So if fast forward, let's say 200 years, 300 years, at that time, there is a people like me and you are talking and they're looking at it, that era of 2026, there were doctors, they have all the tools. They had precision medicine, they have AI, they had genomics, they had multiomics, they have the best treatments possible available. But man, those people are so stupid. They're still developing blockages. They're still dying from heart disease. And why? Because they were not taking action. It is not an era of lack of resources. It's an era of not taking action. So we have to change this paradigm if we truly want to make a difference in anyone's life.
Is there a specific, like, I've often wondered this because when I get my blood done, right, the first thing I do is go in and go, all right, what are my LDLs? What is my HDL? What is my cholesterol level? And is there a specific type of test or specific markers different than what's in the normal thing that maybe people should start testing for or ask their doctors to test for earlier?
Yes, inflammation. So ask anyone, the doctor, I want to know my highly sensitive CRP. CRP is a blood biomarker. You can get done. It's a genetic one. Tells you about inflammation. Highly sensitive CRP is very, very effective. There's a study done using rosuvastatin, a cholesterol medicine, and in the middle-aged men and women. And the patients basically were given, and people who were taking the medium dose of statin, they had less chance of having cardiac event. But people out of that group, people who had less HSCRP, highly sensitive CRP, they had a much lower chance of having heart disease or heart attack than people who had higher, highly sensitive CRP. So if you truly want to check one test, check highly sensitive CRP. Second test I recommend is check ApoB levels. ApoB levels are a precursor or one of the cursors along with the lipid pathway. So if you're checking LDL, don't just trust LDL. Go to ApoB. And if you add ApoB, don't just stay at ApoB. Check LP little a, lipoprotein little a, small a.
Okay.
And check that. Because 1 in 4, 1 in 5, 1 in 6%, depending on ethnicity, people have that genetic mutation. So if you have LP little a high at much younger age, you'll have a higher chance of developing blockages later in life.
So the veterans, on my end, right, veterans, first responders, healthcare workers, high stress professionals, right? How does stress show up in the heart?
Yep. Listening to you.
How does stress manifest itself where you see it in the heart?
Well, everyone has a stress, right? So there's no one who does not have a stress, right? So it's just the stress level is different. What matters is how we handle the stress, how we respond to stress. So if we have the right tools to handle that, think of them, veterans, they are in a stressful situation, in a war zone. They are trained how to handle that situation. Similar way, if we know how to handle our stress level, what are the triggers? And where are we finding peace and calm? If you're finding peace and calm in the wrong choices, that's a bad thing. So what do people do when they're stressful? They eat bad foods, don't exercise, go towards alcohol, smoking. So many of the bad things we do because we think we find a peace there. So we just have to change that. So instead of, if you're feeling stressful, go out for a walk. If you're feeling stressful, find a punching bag and start punching there. Okay, so go to gym, get angry at the weights there. So find a good habits where you can express your anger. Everyone has a stress. We just need to find a way to channel that energy to something productive, something positive for you.
Yeah, it seems like you counteract whatever. If you're going to do some bad, you got to do some good.
Exactly. Do good.
So one of the things that I think is pretty cool between our mission and yours is Charm Clinic, and that stands for Community Heart Failure Assessment, Rehabilitation, and Management. DIL Walk and Advancement Cardiology describe the community-based outpatient heart failure clinic run on a charitable basis with support from DIL Walk Foundation and Advanced Cardiology. Can you tell us a little bit about the Charm Clinic and what problem were you trying to solve with that?
Yeah, so Charm Clinic is a patient with a heart failure. So patient was suffering with heart failure in community. We know if someone has a severe heart failure, means the heart pump is not working to the maximum capacity, less than 50% of power they're supposed to be.
Okay.
The chance for them making 5 years is less than 50%. So basically, it's like having a bad cancer. And those patients usually feel out of breath and they feel the water is filling up their lungs. They can't breathe. They can't lie flat. They feel better when they sit up. They feel swelling in the legs. The weight is increasing. Those are symptoms of the patient with the heart failures, but it slowly by slowly it happens. And they, boom, something happens. They get admitted to ICU, hospital. They give water pills, get rid of this fluid. So there was a huge gap in the community, even though we have public healthcare system in Canada. But many people, we have a tsunami of heart failure patients across America, Canada, and the developing world. So a lot of people are, if they're living from the heart attack, they're developing heart failure. So if they're developing heart failure, who's managing them in the community? No one else. Where they're going back to the hospital, emergency rooms, occupying the emergency rooms, expensive to the healthcare system, and the more often they go to emergency room, the faster they die. So the idea was how we can keep them out of the system of emergency room. This vicious cycle that is running, that they get out of breath, they go to emergency room, they fix them, patch them, send them back, they go back to the war zone again, and then they get worse, they go back to the same place, they get patched them back. So this cycle is going on, we have to break it. So this was Charm Clinic came out of the idea. So the idea was to have a support system in the community. And when they're finding some of the symptoms, they can call someone, a nurse. Nurse can pick up a phone, talk to them, bring them to the clinic, and they help adjust some medications, talk to the doctors over the phone. And this way we can keep them out the longer in the community. If we can do that, they end up going to live longer. And we have proven that by various studies we have done. We kept people out of hospital and millions of dollars saved the public healthcare system. Quality of life was better, and people felt more empowered. There was lack of awareness, lack of knowledge. When they felt knowledge, they understood their problem and how to handle it. They felt good. So this is how the whole mission and the concept came out. And DIL means Dil in Hindi and Punjabi in my language. Dil means heart. There's a heart foundation. So it's essentially what it means. So do it for longevity, do it for life, and that's what Dil means. Do it for your heart.
So this has been such a passion project, right? So what has the clinic taught you about compassion in our systems? Like, is there compassion in our systems?
Well, there is compassion. I believe post-COVID, there is a less empathy in healthcare system, which I'll be honest with you. We as a doctors, we are less empathetic to the patients, and patients are also less empathetic to doctors. Before COVID, there's something happening. We would care about each other more often. COVID showed us the bad side of humanity. We became selfish. And we became selfish, we became rude in healthcare system. Patients became impatient, and they have right reasons, because it was one of a kind trauma. All of us went through that at that time. And there's a lot of misinformation, mistrust, doctors who didn't know it, they were recommending things. And everyone's panic situation. Right? It's like a war zone. You can think of that, right? So in that situation, now we have lost some empathy among us in healthcare system. I do believe we should bring it back. We should listen to people. We should not get angry at them. And all of us, that includes me too. I can't say that I'm not getting angry. I do get impatient too.
You're pretty
We
good.
all are human.
You're pretty awesome. I've spent for the little time I've spent with you. You're a very compassionate, empathetic, good man, and I'm sure the patients that get the luxury of having you are very lucky.
Thank you. Thank you.
So, you said the DIL project, and I know it's based out of Calgary, and it does preventive health, community awareness, early intervention, education, advocacy, research, all of this. Um, uh, Stands for, I guess, do it for life, right? Like you said. And then while WALK stands for wellness, access, linkages, and knowledge, right? So, uh, what is, and if we covered it, maybe I missed, but what is the WALK and why did you start that? Was there a reason that got you to start that, or?
Yeah, because there was a gap we found in community in Canada, South Asian community especially. You can think of this way. In Canada, we're dealing with developing world problem in the developed country. So even South Asian, respective of the immigrants or they were born in Canada, genetically they are high risk of developing heart disease, much bad heart disease, much younger in age. And it has been happening all over the world. But the
Yeah,
data was quite striking for me. So there was a lack of awareness among the community, lack of awareness among the healthcare providers, in emergency room doctors, where the people seek help and they require knowledge. And the higher level, at the community level, or at the political level, at the administration level, there's a lack of awareness. So initial idea was to establish a foundation, volunteer run, 100% charitable. So we registered that in with the Canadian Revenue Agency. So people, if they donate, they get a tax receipts, and 100% proceeds will go towards community initiative, awareness about this initiative. So the campaign was focused on South Asian community initially. So we ran various campaigns covered by media. Even if we ran Western Canada's largest CPR training, because I recognized that this community didn't wasn't aware of CPR, how to do CPR properly. So we found we got donation of 500 CPR kits. We trained over 500 people simultaneously. I did the training myself on a stage, and 500 people in the stadium, everyone or in a big gym. So and they were getting trained same time, and I gave everyone those kits for free to take it home, and then also resources, education. And the only ask I had from them was take this kit and go home and train your family members, train your neighbors, train your village people.
right.
Wherever you are, use these kits to empower people
Yeah, so this is
and
how you're kind of
spread the
reaching.
knowledge.
This is
Yes.
how you're kind of reaching people, that might not have trust or not understand the healthcare system in certain ways.
Exactly. So from there, then we saw there was a war happening in the Middle East, and we saw refugees coming in from Syria and many other countries. And even though the government was helping them, but there was a gap of 1 week in between when they would arrive in Canada and before the healthcare system funding will kick in. But 1 week there was the gap, and no one was covering that gap. And the refugees are coming in, and my dad was born in a refugee camp, so I know what was happening. So we then ran a campaign where we were able to find funding and raise money to help those refugees get medicine at a much wholesale prices. Some more donations there because many refugees are coming in with diabetes, with high blood pressure, with heart disease, with the infections. But for whether 1 week was a critical gap, which no one was covering. So we saw the gap. Then the foundation helped cover that gap. For hundreds of thousands of refugees got help because of that. And then we helped women health initiatives. We recognized some gaps that existed there. So we just finding the gaps, and the foundation kept creating awareness campaigns and whatever we could do a little bit to help bridge a gap. The idea is that we don't have to do everything as a foundation. There are a lot of people who are doing good. It just people don't know who they are, and let's connect them. We don't have to reinvent the wheel. And many times there are a lot of foundation charities, they are looking for people to help. Even they don't know how to get to them. and people don't know how to get to them. So this is how the walk WLK came out. So wellness, access, allowing people to access, create linkages so the knowledge can be shared.
Yeah, so you see such a, I mean, you're worldwide, so you do stuff all over the place, and in all kinds of communities. What would you say is the most underserved community when it comes to like heart health education, to understanding their heart?
I think everywhere. I don't think so.
Really?
Even you could, yes, there's rich countries or poor countries, the gaps are there. So the poor countries, people are struggling with infections, not much from heart disease. So they're dying from more TB, malaria, cholera, dengue, and many other infections are going on. Yes, heart disease is there, lack of awareness, but infection is a main issue. But when we look at the developed part of the world, there's a lot of misinformation. So people are well educated, they speak language, they have access to technology, they still don't understand. Even today, I had a patient who was supposed to be taking baby aspirin or a lipid lowering medication because he had a heart disease, had blockages, but he stopped taking them because in misinformation he saw on the internet, some blog he heard someplace. So a lot of things are happening. So if I say that people in America are more educated or in Canada are more educated than India, that'll be wrong of me to say that. Yes, they have their own challenges, each country, but I do believe knowledge is needed to be done in every level possible.
Yeah. What on your on Doc's personal level, right? And to the Doc, what does do it for life mean to you personally?
To personally to mean is that if helping a person, if I have resources, if I can give up a gift of knowledge, I should give that knowledge because you can give money to anyone, but money can only get to them for a short period. But if I get to the knowledge somehow, and knowledge can be passed on to the generations, then it is going to transform the generation forever. So that's why we founded $1 million of research here in University of Calgary. We did that. Idea was to promote knowledge, research in this area. So
Yeah.
and fund and inspire next generation doctors and nurses and researchers. So and this spark in their mind could then create a bigger fire, and the knowledge can be spread at much faster pace than a speed of light, hopefully. So, and that knowledge will be going to transform us. If I something I can do, share knowledge with other people.
Yeah, that probably that's part of the reasons you got so into AI, but we'll talk about that in a minute. But for our listeners that run nonprofits and churches and veterans groups, first responder groups, what can they do to bring preventive health into their communities?
Preventative health starts by talking about in your homes, talking with your kids, talking about what are the good foods, what are the bad foods. So it's very important to discuss that. So what are the good drinks, what are the bad drinks? We talk about that with our kids. So if you have a food that is packaged outside, and if food is not liked by bugs and is a bad food for you, if the bugs don't want to eat them, don't eat that. So if a bread you put it outside, get bad, it means bugs are eating it. It's a good bread. So start eating those foods. So it's very
Yeah.
important to start prevention from that level. So separating hyper processed foods from the natural foods, which bugs want to eat it, you should eat them too. Which the foods bugs don't want to eat it, a burger or sandwich, leave it outside, it will still look like the same after 1 year. Please don't eat them. So if you have a chips which are refried oil, and if you have drinks with lots of colorings inside, a lot of sugars inside, don't drink them. Go more water side. So start having discussion at home, and start reading labels. If you don't read labels, and today is the era of AI, if you don't understand what the label mean, what they have put inside, ask an AI these days. Take a picture. Any chat can be able to explain that to you, and then find out the good things or bad things. Always remember, there's no one's putting a gun on your head to eat that food. You yourself picking that food, putting it in your mouth, and drinking it. So you can stop that process. If you can do that, prevention starts from there.
So I'm going to switch gears to the company BioArrow. Am I saying that right?
Yes, bioarrow is like an arrow.
BioArrow.
So targeting
Um,
biology.
Biology with an arrow. It's going to hit. It's
Yes,
going to hit the right spot on the
exactly.
first shot. It's publicly described as a precision health company integrating genomics, multinomics, AI, whole genome sequencing, cancer sequencing, microbiome testing, telomere and biology and longevity science. There's a lot of big words in there for a Marine like me, but it
You
does a
good.
lot. Thank you. That was kind of you, Doc. A lot of people hear genomics and think it sounds futuristic or intimidating. I think about my time in college when I went in my 40s and started learning about the genome and how that whole process works and how our DNA and all these things are made up. So if you could, can you kind of explain it at like a kitchen table level to people?
Yes, very simple, easy.
Okay, cool.
Everyone, very simple and easy way to understand. So all of us have stories, right? We agree that your stories are different than my stories, right? Your experiences are different than my experiences. So we have stories, and now we write those stories in a book. So all of us have a stories written in a book, and the stories are written in those words, and those words are the letters, uh, and the letters are the codes, right? Very
Okay.
simple and simple way.
Yeah.
Similar way, your DNA. Your DNA, your storybook, is written in certain codes, and those codes become the words. And somewhere along the way, in that story, when you're reading it about yourself, there's a misprint. By chance, it happened during the printing stage. So maybe someone spilled a coffee at that time. Something happened. Maybe alcohol, maybe smoking, maybe something went wrong with the drug reaction. Somehow the misprint happened. We call it a mutation. And when that mutation happens, sometimes that triggers a disease, triggers a reaction in the body,
Huh.
downstream impact happen. So similar way, when you have a computer has a code. If a code has some kind of virus that attacks it, or a worm comes in, or a bug comes in, and the code doesn't work properly. When the code doesn't work properly, what does it do? Computer starts to hang up, and we have to fix the bug. We have to fix the code exactly the way genomic works. So DNA is a file as big as could be half a terabyte, depending on how much level of the coding we are sequencing it. We are downloading the code level, and when we interpret the code, we are able to tell a person what is your blueprint you're born with it. So that basically your DNA is a blueprint of your life. So your life starts with the DNA, and then you add on other layers of them. So this is how your organs get made. This is how you grow up. Your hair color, your skin color, your intellectual level, your athletic level, the risk for injuries, the risk for side effects of certain medications, and development of heart disease, high cholesterol. Everything is intertwined in those codes. The books you have born with it. If someone is able to download that book, is able to help you interpret that book, that's what genomic is all about. So
Yeah.
essentially, having a health kit based on your genomics, then you can add on the layer of your blood testing, which is downstream impact happening. In a simple way, there's a mutation, there's a tendency to have a crime, but the crime hasn't happened in our life. So sometimes a crime happens, sometimes a crime doesn't happen. So similarly, say if I have a brother or a sister, he or she has a tendency to do a crime. But we are not going to put them in jail because they haven't done any crime. Tendency does not mean there's a criminal intent there. So similarly, if we have a mutation, we are born with a misprint of the code, but the code hasn't caused the malfunction in the computer or a malfunction in my story, doesn't cause a disease yet. We monitor them. We do nothing with them. We keep an eye on it. But when we start to notice that this person is going to go ahead, going to cause a crime, what do? We intercept before the crime happens, right? So that's called transcriptomics science. So you understand the transcription messaging of that. You stop the messaging. You make sure the disease doesn't happen. But if the message goes through that, and the cell get the message, I'm going to cause a disease. I'm going to kill this person. I'm going to commit a crime. That's what the disease is too late now. So now we are at a stage the crime has happened. So very simple way to understand genomic. It's your code. It has a misprint. It may misfire, may not misfire. but we can monitor in today's day and age, when era of AI, and we can understand the drugs are good or bad for us. We can understand the type of muscle fibers we are born with it, the risk of injuries in the sports field, the risk of sudden death on the sports field, and we can excel ourselves, improve better quality of life.
So this is the ATCG, right?
There you
Of
go.
life.
So pretty
So
much.
in that, this sounds like what you described is like all the things that you might miss from a normal checkup. So getting like genetic testing will give you the ability to do the things you just discussed, right? It vice just getting a regular checkup,
There's
or
a
what a
difference.
regular checkup might miss.
There's a difference.
Okay.
Genetic and genomics. Okay. So genetic is an example. Think of an X-ray machine. You do an
Okay.
X-ray of your chest, X-ray of your bone, or ligament, wherever you have injury of that particular area. But X-ray is not an MRI. MRI give you much more
Oh
information.
yeah.
Okay, you know the
Yeah.
difference, X-ray and MRI difference, right?
Yeah.
So similar way difference is genetics and genomics. When there's a genetics companies, so they only focus, they're like X-ray companies. So they only focus a small part of the genome, small part of the chapter in your book. They're not reading your whole book. They're just reading the small chapter in the book and telling you interpretation based on that. It's like you have a Bible, someone open up the random chapter, now read the chapter to you. Are they reading the whole Bible? No. So the
Yeah.
whole Bible is a different perspective, right?
Right.
So
Yeah.
similarly, that's genomics. So genomic means whole genome, whole DNA, over 20,000 gene you're born with it. And what is the interpretation of that? So you can have a Bible, you can download it, but not so different reading a Bible. One is the difference in the interpretation of the Bible,
Ah,
right?
yeah.
What
I
does
mean
that
that
mean?
that was
People
that
were
was
written at that time.
yeah, that was a brilliant explanation. Because I've never understood it that way. So thanks, because that just helped me out a whole lot too. So one of the things I worry about when I think about the possibilities of doing, maybe genetic testing and getting my DNA done, it's probably the reason why I haven't gone and done what is it, the 23, you, me, 23, where you check your family's chromosomes or whatever. What is it people should know or worry about or think about before they give access to somebody with their DNA and their health data?
Well, first they should ask for what the company's intent is, right? Some companies, like your name, so their intent was to trick people, get the data, and sell the data for research purposes to make more
Right.
money. Okay, so first you look at the intent of the company. If someone is giving you offering a cheap test, okay, if they're offering you some cheap test or free test, it means you are the product. They're going to sell you out to someone else. So to think of this way, a whole genome sequencing is a complex science. And if anyone is going to do a whole genome sequencing test, less than a $500, everything, they probably are selling your data to someone else. Because it's very difficult to make a business margins out of that. Okay? So you can imagine someone is doing an MRI for $100. So you know that no one can do $100 MRI. So what will they do? Well, where are they going to make money from? They have to make money from someplace to
Yeah.
make the company run. So you're going to sell your data to someone else. So that should alert you as a company. Doesn't matter who the company is. So do your due diligence and also see, are they going to sell your data to someone else? Are they declaring that on their website? If they're
Yeah.
declaring, if they're not, they're wishy-washy, don't go there. So that's number two, it's a red flag. So number three is, are they going to give you raw file access, the data to your hand, in your hand? If they're saying, no, you'll get a report only, and you'll never get the raw data, there's another red flag. So you should be able to, because you paid for it, you should be able to get a raw file because you are the owner. You can take this raw file, interpretation to some other company. It's like
Yeah.
you have your own book, got downloaded, you got your lifetime story, got downloaded. Why someone else own that download? You can
No,
take it, ask
I want
someone
to.
else to interpret the book for you, right? It's like
Yeah.
someone has a Bible, ask someone else to read it for you. Like why only that person can read that Bible?
Yeah. So on healthcare and AI, right? Let's switch it a little bit. Where do you see AI right now truly helping healthcare?
AI is such a blessing, I can call it. yes, it has its drawbacks. I get that. It's like a knife. So knife, you can use it for cutting a cake, cutting vegetables, cutting meat for food and eating, and you can use a knife to kill someone too. It's not knife's fault. It is an AI. AI is not bad. The way sometimes people think is a person who uses it in the wrong way. So what AI is helping us solve the problem. So genomic is a large complex problem doctors are not trained to handle. They don't know how to interpret the information. It's like you have your book, like a Bible, they don't know how to read it. So they're still being trained in the old way of medicine, MRI, ultrasound, some basic biomarkers, some basic medicines. Now you bring in new medicine in it, and they have no idea how to handle it. They've never been trained in medical school for that. It's a new way. So AI is helping us bridge that gap. AI is taking the science we know and the new science that is coming and putting it together so a doctor can understand in a timely manner, a patient understand in a timely manner, so we actually can provide better healthcare services. So that's what the exciting thing is about AI is. So it's a large amount of data. I can tell you the problem which AI can help solve. So just imagine, so we had one bad person. So let's say Osama bin Laden, we had to find him. In 8 billion people, you can imagine with all the resources we had, how long it took us to find that person. With everything we had, all the money, all the
Right.
intelligence, all the power we had. 1 in 8 billion chance of finding him, right? Similar way, there's a difference between you and me, the mutation you have, the chance of finding a mutation is 1 in 8 billion. It's a similar problem we have as a complex task. Now we have to find the mutation in a highly accurate manner so I can provide a more precise care for you. So I have to do in timely manner. So we need a lot of computing power. We need a lot of AI in it so I can be more efficient. So that has been a bottleneck of healthcare system in precision health because we have genomics. We can download file. Doctors cannot understand the file in timely manner, so patients don't get an access. So our company BioArrow is fixing that gap in many different ways. So doctors can get a better understanding, patients get better understanding, pharma companies get better drugs in the future, and patients can get a better, cheaper drugs in the future, much faster, much earlier.
I know you're big on longevity. Do you see, you want people living longer, people living better, both, or do you see AI playing a pretty big role in allowing that to happen?
It is because we as a human, we are inconsistent. We are not consistent in our work. In the morning, some people are really active, alert. Some are really alert in the late of the evening. But we are not consistent. Hour to hour, we change. Our output changes. So we cause mistakes. That's why the accidents happen, right? So what AI is very consistent. Since we implemented autopilot in airplane, in the airline industry, our crash rates went down. But before that, it was a human pilots controlling it. They're getting tired, exhausted, errors were happening, and people were dying. When we implemented the standards and error rates went down, and we make this flying one of the safest way of transportation on this earth. So similar way, AI is helping us in healthcare these days. So I do believe AI is going to transform, help make us live longer, predict diseases much earlier. That's where longevity comes in play. To me, longevity, the company we founded called Longevity, is a longevity with biology. So I was
Hmm.
talking to someone in Dubai who want to invest money into this company and they want to launch it globally. And I said that we are focusing on biology. We are focusing on science. We are not focusing the trends. Yes, people can go make money. They can sell whatever they want to sell in the market, make money and be rich. That is not my focus. We
Right.
have to be true to the truth. We have to be true to the science. You can't lie to the science. If you lie to the science, science will lie to you. Then you get the wrong results.
Yeah.
So that's what longevity to me is. So we have to be true, we have to be pure to the science, keep running experiments, keep asking questions, and we'll find a way. And we have found some ways, and other people have found some ways. I do believe we are at a stage right now in humanity where I can see kids that are born today or in their teenage years right now, they can easily hit hundreds or 150 years of age in their lifetime. So, and we have done that before in lifetime. If you remember, 120 years ago, of life expectancy wasn't there what we have today. we have more than double the life expectancy
Oh
already.
yeah.
So we have achieved that in humanity. So now the kids that are teenage age group right now, they will be the hundreds years of age, like the 50s of today. Kids that have no diseases, they're productive, they're active. And then once we hit that age of 100, healthcare system of 100 years of average age, then we'll be pushing limit towards 150. That is
Yeah, that,
coming.
that makes me think about like the myths of longevity, right? Like, my dad lived till he was 94, my mom lived till she was 92. Their parents lived a little bit shorter than them, and it seems like, through the modern medicine and all the stents my mother had put in, she had 9 of them. But, she had a lot of cardiovascular issues. But all the things that happened, they lived a much longer life, right? Um, One of the things I got to witness though in that long life, seemed to me like a myth. Like, well, you got to live till you were 94, but your quality of life stopped when you were like 85.
Exactly.
So what is
So
it that we're
you're going
doing
this
in the
way and then
longevity
suddenly
game?
going down.
Yeah, what are we doing in the longevity game? I mean, it's one thing to live longer, but living longer in a nursing home isn't living longer. So,
No.
what's going on with that?
And think of this, of why is that the problem? The problem became because we made advances in cardiovascular care. People were dying 50 years ago from heart attacks and heart disease a
Yep.
much, much younger age.
Yeah, I
So
would have been one
medical
of them.
innovation, exactly. So we are living longer. So, but longer doesn't mean we are living healthier. So we were just basically prolonging the misery. Yes, we are able to adding some lifetimes to the life there, but we are removing the life out of it. So we need to add life back there. So we have to keep them healthy the longest. So the disease is happening in their 30s, 40s, 50s, and we have to make sure that we move this needle towards 70s, 80s, 90s. If we can do that, which we can today, what we know in precision medicine, genomics, microbiomics, epigenetics, telomeres, which you're mentioning, as we combine things together, we can move this needle, the disease occurrence at age of 40 or 50, to 70 and 80. Now you can imagine that you're living 80 years of healthy, no disease. If you have hundreds of age, but you're not that bad,
Yeah,
you're
no,
not stuck to the
I
bed.
can imagine it. I'd love to live to 120 if I could be happy and
Yes.
healthy and have enough money, because that's the other thing you need.
You need money too, exactly. You need that.
Got to have enough money to live a long time. So if I could have a good quality of life, I like life. That's for sure. And what I can give in my life, giving back to others is the one thing that makes me the happiest. So if I can keep giving, I'm pretty sure that the good Lord above wants me to do it. So towards the end of life, what would you say patients have taught you that really matter? Because, being a cardiologist, you see people at the end of life. You try not to have that happen, right? But it does. What has being around people at end of life taught you?
Well, I can share a true story, and it's a true story that changed my perspective in my life. I was doing a residency in Winnipeg, in Manitoba, and I was a resident in CCU. I was assigned to manage patients that night, and I was managing, and one lady comes in, older lady, and she was passing out in the community. So we hooked her up, and we saw that her heart was stopping for a few seconds, and we saw that she needs a pacemaker. So we took her emergency room to CCU. So when at CCU, I end up putting a temporary pacemaker wire because I knew that my seniors will come in the morning. So they would come in the morning to put a permanent pacemaker, which she needs that, but she needs to be now monitored for the night, so she's safe. So in the morning we can put a pacemaker, and the nurses and everyone will come to the hospital like 7 a.m. onwards. So it's around now 11 p.m. night time. So to make sure 8 hours she's okay, and so I moved her to CCU, put a temporary pacemaker wire, and I looked after the patients. And then suddenly I get a call from nurses, cold blue. I ran up to the CCU, saw that she had a flat line, and then she had a pacemaker wire. I moved the wire, heart will start to beat again, and should be come back to life again. So then I went back to emergency room to look after the patient. Few minutes later, again there was a code blue. So I went back to the patient. Again, the wire was so flimsy, it's a rubbery wire, and it could move within the heart. She would have a disconnection there. Heart will stop beating, and I will start back again, and she will come to life again. So literally, those 5 6 hours, I was kind of, I'm not saying I was playing God, but I could see the difference between life and a death. If a wire is connected, she's alive. She will come back. Dr. Kapoor, thank you, I'm back. If the wire is disconnected, she's dead. So
Wow.
those 5 6 hours taught me lifetime lesson. Life is very, very precious. And you don't know when your last day will be and who's going to help you that day. If you're lucky, you'll be able to be alive. You'll be able to see the next day. If you're not lucky, you may not be alive around for the next day. So those 4 5 hours were very stressful time of my life that time, and they gave me a perspective, different perspective of life altogether. So life was just a fire, that wire in my hand. I could move it, she's dead. Not move it, she's alive, and that's precious the life is. And so I made her last whole night, made my seniors to come earlier because I said I cannot run this standing by her and keep changing these wires. Doesn't make sense. Please come early. They came by 5 a.m. We were able to put a permanent pacemaker in her. She was able to leave hospital, go back to home. But that's a lesson I learned.
Unbelievable, right?
Yes,
That's just it. It's unbelievable. So life by wire.
it is literally live by wire.
That's unbelievable. Listen, the this show that I have, the podcast, my nonprofit, We Do Good. Check it out at wedogood.org. Everybody, see the good deeds we do. This show is built around the idea that one good deed can change everything, and that's kind of how you and I met at Mar-a-Lago. Was you kind of
Yeah,
like
you're
my
sporting the
vibe?
blue. Yep.
Yeah, absolutely. um, what is one good deed that you can say you did that changed your life? It changed you who you are. Just one.
Well, there are many. It's hard to say which one or which
I know
one.
you've done a
So,
lot of good deeds.
yes, it's hard to know which one, but every deed is a good experience. It makes me a better human. And people ask me sometimes, and they Anmol, why do you do this? Why do you help other people? I said because I get a positive energy coming back from them. So when someone you help and say thank you back to you, and that's something energy, positive energy I needed. When you asked me earlier, that Anmol, how do you keep going? Like how do you have this spark energy and you want to do these things? These good deeds are helping me do that. So whenever I feel I'm down, I go and do something good, and I get this positive energy coming back to me. I come back to my task again.
That I totally get that.
It's
um,
addiction. It's a
wh-
positive. I'm addicted to that. So if I
yeah,
don't
me
do that,
too.
my energy level goes down. If I have my energy level to bring it back, just to do good deeds.
Absolutely. And then I'm feeling better. I'm like,
Exactly.
okay, well,
That's my
everything just
tonic.
got better. Yeah.
Yes.
So in medicine, which is a different realm, right? What is something you've witnessed another doctor or another person in your field do that it just took you back and you'll never forget as far as goodness to another person?
Well, again, this is another question come down to your luck. So there was a patient during my training, and the patient was very sick in again in ICU, CCU, elderly patient. So I had a heart attack, and one of my supervisors put a stent in. I was still training, and he said, "Mole, so patient is very sick. So we don't know he'll be able to make it. We put all the pump, we did all those things. Now I'm going home. You look after him." So I was able to find a bed for him in ICU because there was a fight between ICU and CCU doctors. It happened in hospital sometime. You may have seen ER shows. So I was able to find the bed, and the person was saying, "Let him go. He's an old guy. Like we have done everything. He's in shock. He lived his life. He may not even see the end of the next day." So and my supervisor was able to put a stent, was able to put a pump and all of those things. He fought for him. I was fighting for the patient, convinced him to come from home and help this patient out. And this patient, next day morning, woke up, we were able to get his everything, all the wires and everything removed by the end of the day. And a few days later, he went home. So that taught me something, that is luck plays a huge role in the healthcare system. If you have a doctor who can believe in you, who can fight for you, can make the difference between life and death. Because there are
Yeah.
other doctors which I was fighting with them, and they were looking at the bed. They wanna preserve the bed for maybe someone else. They thought, okay, this guy's an old patient, and maybe he lived his life. He's in bad shape. Maybe let him go. Maybe give this back to someone else. But I was able to fight, and my supervisor listened to me. He came home from home to help this patient, and I stayed with him whole night and be able to get him through. So that's a lesson I learned. That is, if you're lucky, if your deeds are good enough, maybe he had a good deeds, that the doctors are able to fight for him, and he's
Right.
able to go back to his family. And I hope when I'm in that situation that someone will do that to me.
Yeah. That's amazing. So it kind of leads into what my next thought for you was, which is, there's a lot of young doctors out there. I'm not saying that you're not a young man, doc, but there's a lot of younger doctors. Um, so
Thank
younger
you.
doctors, entrepreneurs, nonprofit leaders listening to the podcast that might come on. What advice would you give them about building something meaningful?
Well, listen to your heart. And if something that can save someone's life, can make a difference in someone's life, and there's something you can do, you have power to do it, do it. Don't hesitate.
I love that. That's awesome. All right, I'm going to hit you with a few rapid fire questions, and we're going to wrap it up. All right, so just first thing that comes to your head, throw
Okay.
these out for me, okay? Are you ready? All right.
Okay.
Best health advice you ever received.
Stay active.
Okay. Worst health myth you've ever heard of all time.
Say it again.
Worst health myth you've ever heard of all time.
It's hard. The worst, stopping medicine.
Okay. Okay. One food or habit you recommend for heart health.
Sticking to vegetables, fresh fruits.
Okay. One thing every man over 40 should check.
Their high sensitive CRP, their ApoB levels.
Okay. One thing every woman should know about heart disease.
Getting their higher sensitive CRP checked out is very important. Inflammation kicks in much earlier, and we miss out sometimes.
Okay. And a book, a quote, or a belief that guides you in life.
A quote by Indian president who, once he started, dreams are not the one we see them when we sleep. Dreams are the one that keeps you awake until you achieve them.
That's a good one. All right. And finally, what does doing good mean to you?
Bringing a smile to someone's face.
Me as well. Dr. Kapoor, thank you for joining us today. What I'm taking away from this conversation is that healthcare is not just about treating disease. It's about prevention. It's about access, education, and helping people before they even get into a crisis, right? Our listeners, schedule a checkup, make the call, take the walk, ask the question, see the doctor, tell the people you love that you love them. Never let that go unsaid. And remember, one good deed can change everything. And sometimes that good deed might even save a life, like the good doc here has saved so many. Ladies and gentlemen, this is Charles Dame. Thanks again for joining me for the We Do Good podcast. And remember, good day and good deeds. And we'll see you next time.
Thank you so much for having me.